I don't have the Snellen's chart, so I'm going to explain that. With the Snellen's chart, you'll have the patient to stand 20 feet away from the chart and have them to read the lowest line that they can see with the left eye, the right eye, and then both eyes. And that's how you measure their vision from a distance. I have my gloves on. I've already washed my hands and put my gloves on, and now I'm gonna start with the head to toe assessment. Okay, Miss Kamar. All right, I'm gonna look at your head. It's normal cephalic, and now I'm gonna look through your head. I see that hair is evenly distributed through your head. I don't see any lesions, lumps, no alopecia. Are you having any pain?
No.
Okay. And I don't see any lice or any infestations. Okay. Well, now I'm gonna move down to the face. I'm gonna take these gloves off and I'm gonna wash my hands. Okay, I'm just gonna look at your face. Eyes are symmetric. They're midline. The nose is midline, and as well as your lips, they're midline. And everything is symmetric. So now I'm gonna shine the light and look at your pupils. Both pupils do constrict, and before I shine the light, there are 3, and afterwards they constrict to a 2. Okay, I'm gonna have you to follow the pen light for me, and keep your head still. Patient able to do the 6 cardinal of gaze. And then I'm gonna bring the pen light towards your nose. And eyes accommodate. And before I started that, I was looking at her eyes, and the sclera is white in color. And conjunctiva is pink in color, is moist, and she has no drainage from the eyes. Now I'm gonna assess her nose. Her nose is midline. I don't see any drainage noted to her nose. I'm gonna look on the inside. Nose is clear, it's pink and moist. I don't see any polyps. And could you hold your nose for me? One side and then blow. And then do the other side. Nose is patent. And while I'm there, I'm gonna palpate her sinus cavities. I'm gonna do the maxillary first. All right. Do you feel any pain?
No.
Okay, what about here?
No.
All right, patient denies pain to the maxillary and the frontal cavities. All right, now I'm gonna look at your mouth. Lips are pink and moist. I don't see any dryness. All right, can you open your mouth for me? Okay. All right. Can you open your mouth for me? Um, Patient teeth are white. Gums are moist. The buccal mucosa is moist on both sides. Can you hold your tongue up for me? All right, it's moist on the bottom. Patient has no lesions. Hard plate and soft plate noted. All right, stick your tongue out for me and move it from side to side. Okay. Patient able to move tongue from side to side in his midline. Say off for me. Yeah, stick your tongue out. You gotta hold it down.
Alright, what?
I gotta see your tonsils and you will. Okay. Say off. Alright. Uvula midline tonsils are moist, pink. And they are 2+. Now I'm gonna check your gag reflex. Okay. Gag reflex present. I'm sorry.
It's alright.
Okay. Alright, while I'm on the face, I'm gonna palpate the temporal arteries. They are +2. And then I'm gonna put my hand on your TMJ area, and I'm gonna get you to open and close your mouth for me. Okay. Do you have any pain?
No.
Patient denies pain, and I don't feel any cracking going on. Okay. The other thing I'm gonna get for you to do for me, raise your eyebrows. All right. Smile. Make a frown. All right, and puff your cheeks out for me. Patient is able to do all those things, and I don't see any facial drooping or no involuntary movement. All right, now I'm going to move on to your ears. All right, ears are symmetric, and they're even with the corners of the eyes. I'm going to look at this ear first. I don't see any drainage. I'm going to go to the other side. I don't see any drainage on that side as well. Are you been having any issues with your ears?
No.
Okay. And I'm just going to touch on your ear. Do you have any pain?
No.
Okay. All right. Patient denies pain on both sides bilateral. I don't have an otoscope, but I will look into the ears to look at the tympanic membrane and to make sure it's shiny, a pearly gray color. And I will also make sure that she doesn't have any perforations into the ear. Okay. Now I'm going to do the whisper test on you. I'm going to whisper 2 words in each ear, and you just repeat the words. Okay. Let me get you to cover your right ear, okay. And then I'm going to whisper in your left ear. And just repeat the word after me.
Cat. Dog.
Okay, and then we'll do the other ear.
Sky. Blue.
Okay. Patient was able to repeat both words and to both ears bilateral. Now I'm gonna move on to the neck. Can you roll your neck up? So okay. I'm gonna assess the neck. The trachea is midline. I don't see no obvious lesions, redness, or swelling to the neck. And I'm just gonna palpate the neck. Do you feel any pain?
No, but like my throat sometimes is sore. I think that's just from me vomiting, but
okay.
I don't feel no pain.
All right. And I'm just gonna stand behind you, and I'm gonna get you to swallow for me. All right, swallow for me. Okay. Thyroid glands are not visible, and I don't feel them. They are not palpable when she swallows. All right, I'll take that from you. I'll see it over here. Alright, and while I'm here, I'm just gonna palpate your lymph nodes. I'm gonna start up here. At the front of the ear, then I'm gonna go behind the ear. I'm not feeling any nodules or anything. Are you having any pain?
No.
Alright. Alright, now I'm gonna get you to turn your head to the left for me. And then to the right. I'm gonna get you to hold it down. And then hold it back. Okay. Patient has full range of motion to the neck. And now I'm gonna just stand behind you again. And then I'm gonna get you to shrug your shoulders for me against me. Alright. Patient's shoulders are symmetric and she has good strength to the shoulders.